Good afternoon. It is the 4th of June, and yesterday I had my second appointment with my CBT therapist. Really, it was just another assessment visit looking at some of the issues that really make me anxious around hospitals, needles, blood tests, dentist. And she made me focus quite a bit on the coping strategies that I've used for a long time, such as putting on the EMLA, the anaesthetising cream, before I have any kind of blood test needles. Because it's clear, or it's become clear as part of the appointment yesterday, that it's not working for me anymore. And I know some of that is related to the 3 quite bad experiences I had at the sedation clinic last year when they attempted to get a cannula in so they could sedate me to have this tooth filled. And it's just kind of put me back a long way, really. So I'm no longer convinced in my head that the EMLA cream will work for me. We've looked at the different coping strategies, and as I say, she has identified that it would appear that most of them are not working for me. She has clearly told me now that it will be exposure therapy, and at some point during this course of treatment, I will be having a needle stuck in me. It's as simple as that. Obviously, I don't feel great about that at the moment, but I know it's all part of trying to reduce the levels of anxiety. And when I say levels of anxiety, I think it's unnatural levels of anxiety around the thought of having to have a blood test. I also spoke about there's a couple of things that I really could do with seeing GP about, and I don't talk about it, I don't tell people about it, and I'm not going to say on here about it, but there's a couple of things that I kind of niggle in and they're in the back of my mind, and I keep putting off going to the doctors, because usually the first thing when you identify you've got an issue is, we'll take some blood tests and see what is going on. And that makes me really anxious, therefore I avoid going to the doctors. Hopefully, with this treatment, it may mean that I can go to the doctors and talk about a couple of things that are worrying. When I say worrying, I don't know. Just like I said, niggling in the back of my mind, and maybe I ought to discuss it with a GP to put my mind at rest that there's nothing untoward going on. But we'll see. Anyway, another appointment next week. I've got some forms to fill in about the things that I worry about, things that I perhaps don't do, or I struggle to do, or I'm reluctant to do because I'm worried that it means I'm going to hurt myself, that I have to go to A&E, and that really goes around that cycle of if I go to A&E, I'm going to have a needle, I'm going to have blood tests. So I've got this list to go through to prioritise the kind of areas that we need to look at during the therapy. So that might sound all a bit confusing to you guys, but I know what I'm talking about, and hopefully it'll... we'll address those issues throughout the next few weeks. Thank you for listening.